Medicare changes every year. For 2026, we have some big changes. Medicare Part B, what you pay monthly for Medicare Part B, which is everything outside the hospital, doctor visits, labs, x-rays, that is going up the largest increase that we've had in about a decade, 11%. So it's going from $185 in 2025 to $206.50 in 2026. That will automatically go into effect in January, and if you're on Social Security, they will automatically take it out of your Social Security check. If you're not on Social Security, they were sending you a bill, or you're signed up for Medicare Easy Pay, you'll get a higher bill. Now that's what the average person pays for Medicare Part B. You might be below average. Your income and your assets might be lower, in which case you might be getting help paying for some or all of Medicare Part B. A lot of people don't know about the Medicare Savings Program. It's a program in your state. So go to the internet, type in Medicare Savings Program and your state, and it will pop up. You can apply at any time. So if you missed doing it a couple years ago when you started Medicare, you can do it right now. Or if you applied before and you weren't eligible, you might become eligible now. Again, if you're below average income and assets, you might get help paying for some or all of your Part B. You could be above average income. What you pay for Medicare Part B in 2026 will be based on your adjusted gross income from 2024. So, what you did in 2024 might mean you pay a lot more than $206.50 a month due to the Medicare IRMA surcharge. And I go into Medicare IRMA in my book, Chapter 7. If you don't know what Medicare IRMA is, if you're afraid of triggering it, find my book on Amazon. It will help you strategize to eliminate or reduce Medicare IRMA. But it's too late for 2026. If you've already done something in 2024 that increased your income, such as you sold your business, you sold some rental properties, you sold your house, those things will drive up your overall adjusted gross income. And depending exactly what thing you did, you might not be able to appeal it. You'll just have to pay the piper, meaning you'll pay more for Medicare Part B in 2026. So how much more you pay will depend on the Medicare IRMA chart. We don't know what those are yet. We know what they are currently for 2025, but we don't know how they'll be raised. And they don't go up like 3% a year like other things do with inflation. The Medicare IRMA charts are all over the board. Sometimes they go up a lot, sometimes they don't go up a lot. So we're in the dark right now. But they'll be released soon. We generally have those numbers in the mid to end of November. So you will look at the Medicare IRMA charts and you'll say, ooh, I took a lot of money out of my 401k in 2024 because I wanted to pay off my mortgage. I wanted to help my son with a down payment on his house, whatever you did. And that was a one-time increase of your adjusted gross income. And you're like, I'm not going to do that again. Can I appeal that? No. That's not an appealable situation. What you could appeal is if you retired, if you were still working full-time in 2024, or your spouse was, and now as you go into 2026, you're no longer at that income, that is something you can appeal. That's what we can help you with at the Medicare family, give you the form, explain how to send it in, what the deadline is, and that is called a SS-44. If you want to look at that form, you can check that out now on the internet. How much you pay for Medicare Part B is going to be based on your specific situation, but in general, it is going up. What is the Part B deductible going up for 2026? It's going up from currently $257 a year, it's an annual deductible, up to $288. So it's not too bad. It's actually amazingly under $300 when the deductible on many employer group health plans, or if you're on the Affordable Care Act, Obamacare, could be $6,000, $7,000, $9,000. So a $300 annual deductible on Medicare Part B is extremely attractive. How about the Part D drug plan? The premiums on the Part D drug plan are very controversial. I don't know exactly how to explain it. They're generating a lot of negative press. Not all plans. There are some plans that went up a couple dollars. There are some plans that did not go up at all. But there are a lot of Medicare Part D drug plans that went up $50 per month. $600 raise for the year. That's a lot. That's unprecedented, and it's got a lot of people very upset. That is the maximum the government allowed drug companies to raise their plans. Some drug companies wanted to raise their plans higher than that, and the government wouldn't let them. We've never had that situation before. We had an insurance company say, well, if you won't let me raise my rates, I'm not going to sell a drug plan in this state. And they're completely leaving some states because they couldn't get the rate increase that they wanted. So I don't know if that makes you feel better or worse that you only got a $50 a month increase. But if it wasn't for the government stepping in, it would have been worse. Now, what actually happened to your drug plan is in your annual notice of change letter. That's the letter they have to give you every September. If you didn't get it and you're still in the dark, you don't know what your plan is changing for 2026, you can call your company to get that letter. It might be in your client portal. If you're enrolled in the client portal with your insurance company, you might be able to find it under plan changes in there. So some plans didn't go up a lot, some plans went up the maximum. The deductible on Medicare Part D went up, and it went up to $615. Now, in the past, a lot of companies did not charge the maximum deductible, or they didn't charge the deductible to you at all if you were taking a cheap drug, if you were taking a generic drug, a tier 1 or a tier 2 drug. You want to watch that because we're in an inflationary environment right now where more plans, like I said, they wanted to charge more than $50 a month. They couldn't. So they're going to charge the deductible on more of their drugs. Another thing they're doing that's kind of tricky, a little bit sleight of hand, is the amount of drugs that the drug plans cover is getting slimmer because that saves them money. The maximum you can pay out of pocket on your Medicare Part D drug plan for 2026 is going from $2,000 in 2025 to $2,100. So not bad, $100 more. But what is bad is the companies don't like this cap. In 2024, the most you could pay out of pocket was $8,000. So when the Inflation Reduction Act brought us this $2,000 cap for 2025, it helped a small percentage of people. They were very happy. But the vast majority of people, in order to pay for this small percentage of people, saw that a lot of their drugs were not covered, meaning they had to cover it out of pocket. You'll see more of that for 2026. So if you got your annual notice of change letter and you're like, oh, I don't really like what this looks like, you might be shocked to find that there's nothing better for 2026. It pays to shop. Go to medicare.gov. It'll say put in your zip code. Then at the bottom, you'll say, I want to look for health and drug plans. And then you will put in your drug plans, and Medicare.gov will tell you if there is a drug plan that is cheaper for 2026 than what you have right now. So we went over Part B. Part D, what else is changing for 2026? We don't have any major changes from the Inflation Reduction Act, like the big $2,000 cap, but we do see the first year of negotiated drug prices. And that is 10 drugs. There's 10 drugs that will be lowered by the government. Number one, most popular being Eliquis, but Januvia, Xarelto, there's 10 that you can look at. So if you are taking one of those drugs, and those are some of the most common drugs people on Medicare take, some of the most expensive drugs, you'll be very happy to see that the price dropped on average, I think it was like 67, 70%. So that is a win. If you're only taking one of those 10 drugs, you're going to be happy. But the insurance companies weren't happy about this. The drug manufacturers were not happy about this. So they have responded, as you can imagine, by raising the price of other drugs so that they don't take it in their bottom line. They're not going to have reduced profits because the government is forcing them to reduce the price on these 10 drugs. So overall, you will find on your drug plan for 2026, fewer drugs covered. You're going to pay a higher monthly premium in many cases, but not all. You'll have a higher deductible, and it might pertain to all your drugs, not just your expensive drugs. If you have Medicare Advantage, what's changing for 2026? We have, again, unprecedented amount of companies that are saying, ooh, I don't like your county. We're going to leave your county, and you need to find a new plan. That's called a Medicare Advantage plan exit. They can't do it because of you. They didn't like you. They can't say, oh, you're unhealthy. They have to do everybody on that plan in that area. And we have over 1.3 million people that are getting notified they got to find a new plan for 2026. So make sure you're reading your mail and you know that you have to choose a new plan, because a lot of people are like, my plan changes a little bit every year, I'm fine. Well, if it's gone, if your plan is exiting, that means that as of December 31st, you are back on original Medicare A and B on January 1st only. You don't have other coverage. You don't have a drug benefit. So if you find this out in January, and a lot of people will find this out the hard way. They'll go to the doctor and they'll find out, their plan canceled. They don't have drug coverage when they go to the pharmacy. That's when you'll call us and we will tell you, okay, we can get you on a plan, but it won't start till February 1st. So for the rest of this month, you might need to delay your procedures. You might need to use drug discount cards, ask for samples, because your new coverages that you're going to have to choose won't start till the first of the next month. So big changes for about 1.3 million people on Medicare Advantage. How about the rest of people on Medicare Advantage, that their plan is not exiting, but it's changing? Generally, the premium, if you had a zero premium plan, it's staying zero premium. People like that. That's one thing that insurance companies don't like to touch. But many people did pay a premium in 2025. And if you are paying a premium, expect that to go up for 2026. Now, it's hard to talk in generalizations because there's over 4,000 different Medicare Advantage plans filed by all the different counties. But in general, if you paid zero, you'll probably pay zero. And if you paid a premium, you'll probably pay a higher premium. Medicare Advantage plans are getting a little bit slimmer for 2026, meaning the extras, the dental, vision, you might have transportation, you might have meals after a surgery, you could have a grocery card or money for utilities. Those in general, again, it varies by your plan, got slimmer. So if you had a $2,000 dental benefit last year, maybe it's $1,000 this year. I've seen plans that were really great in 2025 that now only cover an exam and cleanings, nothing extra. The insurance companies are cutting costs because of inflation and a lot of other factors. So be sure and look at your extra benefits, especially if that was the thing that attracted you to that plan. And if you're not happy, if you're one of our existing clients, you can go to our website, themedicarefamily.com. In the top right-hand corner, there is a client care portal. Click on that. That's where you will say, hey, I'm not happy with my new plan. Please call me to schedule to review my plan and see if we can find anything better for 2026. You can only book an appointment with our team a week in advance. So if you go in right now and you find there's no appointments, wait a couple days. We keep opening more appointments up so that we can definitely help you. If you don't find any appointments and you're in a panic, email us, hello@the Medicare Family. Tell us what your situation is, and we will make sure we get to fit you in. Again, check your Medicare Advantage plan changes, because some of them are changing dramatically. Some of them are just changing a little bit. In general, I'd say about 10% of the plans are staying relatively the same. About 40-50% of the plans are changing. And then the other 30% of the plans are changing a lot. So you need to be aware and take advantage of the annual election period. October 15th through December 7th. Make your changes there. Don't be caught off guard in January. Don't be one of those people that said, I didn't want to mess with it because Thanksgiving and I had guests from out of town and getting ready for Christmas. No, this is the window the government gives us. Take advantage of this so that you can get yourself in the best plan available to meet your needs for 2026. Again, if you have questions, you can put them in the comments below. You can email us directly, hello@the Medicare Family. Or if you know you want to get an official plan review set up, go to our client care portal and we will call you and get that booked. Thanks for watching. If you're new, please give me a follow. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment if you have a specific question. Always feel free to call us or email us at the Medicare Family.